Hi everybody, it's Peter Stockdale, the host of the Spin Market Report. Are you looking for a new place to advertise your business? With over 85,000 YouTube impressions and 20,000 total streams across all platforms in the last 12 months, the Spin Market Podcast Network could be the prime space you've been looking for to advertise your business. Get a hold of Spin Market today and see what advertising on a podcast can do for you. Visit www.spinmarketwith2ks.com or email digitalagent@spinmarket.com for more information.
It's the Spin Market Report. Here's your host, Peter Stockdale.
We're back. Spin Market Report, another week, another podcast. This week we're sitting down with Dr. Cindy VanSickler. Doctor, that's cool. We've had a couple doctors on here. This is really neat.
Yeah. We're just getting all the doctors on here.
Yeah, I know. Well, that's part of the podcast. We're talking to all the people around this area and surrounding areas, what they do, why they do it, the marketing efforts they have, their business plans, etc. So we're going to talk with Cindy about a little bit of this stuff. You're a chiropractor, correct?
Correct.
What got you interested in chiropractic work?
It sounds kind of cheesy, but back in high school, you guys ever been forced to like do those papers about what you want to be when you grow up?
Yes.
That's kind of where it started, like my interest in it. And so the reason I like researched chiropractic was, I grew up with two parents who weren't like extremely healthy individuals, and they were like older for their ages for having us kids. And so I was really aware of like the medications and the different health issues they had. And I thought, well, there has to be like a better way of like living life than just like having all these health conditions and being on all these medicines. So then I started researching like more holistic avenues, and obviously chiropractic came up in the forefront, and then the rest was history as to why I got into it, because that point on I knew my track, I knew what classes I needed to take, where I wanted to go, and yeah.
I feel like you said holistic. I feel like chiropractic work, like maybe 50 years ago was something they were just like, this is kind of holistic, but nowadays it's almost just common practice.
Yeah. So when we kind of refer to chiropractic within the holistic frame, we are talking like no medicine used.
There we go. Okay.
Yeah. So and then you see some hybrid offices like do different kind of, or offer different kind of injections and stuff, but that's of course through a nurse practitioner.
Okay. That's
within their facility.
Okay.
Otherwise, chiropractic care is done by hand.
And no medicine usually.
No medicine.
All right.
Yes.
So that's awesome. So I had a question on here that was, what distinguishes the difference between a chiropractic sports physician from just a general chiropractor? Yeah.
So I graduated from Palmer as just a chiropractor in 2012, and then I practiced my first 3 years up in the Twin Cities. There's another chiropractic school up there that offered the sports certification. And so that was, I think I got it done in like 3 years. It's over 100 extra credit hours, but the credit hours are very specific to like athletic injury prevention, treatment. We take EMT courses. We can be on field. When I was up in Minnesota, I was on field with a semi-pro football team. And so we kind of do similar things as athletic trainers on site. And so that when you get done with the coursework, you do some practical work, then you take a board exam. Okay. And so once you pass the board exam, just like we did pass the board exam for the chiropractic side of stuff, then you become a CCSP. So part of those alphabet behind my name is the certified chiropractic sports physician.
Awesome.
She's
Going for all the alphabet.
Yeah. Yes. I want all the no.
It's nice to know you have to pass boards to be a chiropractor.
Yes,
it's not like it's just like, I learned how to crack somebody's back and now here we are,
Right.
chiropractor.
I saw a TikTok and
oh my gosh. Wow.
I had to.
That reminds me of like the high school of like when girls would pop each other's back.
Yes.
I could never let anybody touch my back.
I tell
physically
people
could not.
Yes, I tell people that story. There was someone on our volleyball team. She had gone to the chiropractor, come to practice, and she's like, "Guys, look what I learned." And you look back on that, and you're like, "Oh my gosh, that was so risky."
Yeah, you got somebody over here that's not qualified, that's rearranging pieces of somebody's spine.
Yes.
Basically. So you became a general chiropractor, went and took more specialized coursework, and then became a sports chiropractor, or a sports physician chiropractor, right?
Yeah. And that, and again, it was all about very like scientific minded. Like I'm always trying to find an answer. When a person comes in, I don't just see the patient, I see and listen to what they are saying about their condition. And it's really, what's exciting about me is like digging in and investigating like the why behind the injury. Okay. Not just like, okay, how do I get rid of this person's pain? I want to know, why did that pain even occur? Like what malfunctioned to create the condition that they're struggling with.
Okay, yeah.
So, yeah.
And that would make sense because like if you're in sports, it's probably you get different injuries than if you're just, you know, a person walking around day to day.
Yeah. But with the beauty of it that I noticed, because you know, you're young, you think you have your life figured out. And I was like, yeah, I'm just going to work with sports teams. And then when I moved back to my hometown of Fort Dodge, I was like, well, this translates well into weekend warriors or normal people, because I mean, we have all like ice in the winter. Who has not slipped? Yeah, exactly. And it's like, so if you just break down, hey, that was in a sense an athletic injury, and then how would you approach it with an athlete? Well, you just tweak load, or you make stuff slightly easier if the person's not at like a performance level. That
makes a lot of sense.
Yeah.
So you'd mentioned coming back to Fort Dodge.
Yeah.
Did you come back and immediately open Function First, or
no?
Okay.
I got offered a position at another chiropractic office in Fort Dodge. That's what brought me back to my hometown. And then again with my sports certification, like continuing ed that I was taking for exercise therapy, getting people more active with their treatment plans, I decided, hey, I don't really fit in this standard model of chiropractic office. I'm not big on seeing a person after a person, like within 5 minutes, and then I see another person, and then I see another person, because I see it more valuable to not only adjust, but again, evaluate the person biomechanically and figure out why that needed to be adjusted. Yeah. And then is there a strengthening or stabilization exercises I can give that person that, hey, maybe then they don't need to be adjusted in that area.
It's like your shirts that you hand out to everybody.
Yes,
Have you done your stretches? Yeah.
So the first shirts I made when I opened Function First, on the back it says, did you do your stretches? Because from day one of practicing, I've always, you've got to like have people invested in their own health. Because if they have nothing that they need to be doing, then the message given to them is, you're going to fix me. I just need to come to you to be fixed. And it takes the power, like, to me, it takes the power away from the patient. Yeah. And so that's like with my mission statement too, educate and empower, because both of those things, if you feel like, hey, I can do something for my health, I can fix this, you're going to go out there and you're going to start moving more. And if you start moving more, then you're going to reduce your risk of like heart disease, reduce your risk of diabetes. So it's so multifactorial with just a little bit of encouragement in like the movement realm of things.
Yeah, I feel like that's starting to be a thing that's changing a little bit in the medical field, where it used to just be like, I go to the doctor, they give me a XYZ, I go home and I take it, and then it's just the symptoms are gone and I'm better.
Yes.
But it's nowadays people are asking, why did I have to go in the first place? Yes. And they're kind of taking their, I want to say like preventative maintenance health kind of stuff a little bit more seriously. And that's kind of what you're trying to incorporate this professionally into your chiropractic work.
Yeah. So I just saw that I couldn't be that doctor for my patients if I was forced into a model where I just had to, like, it was all about, you know, more or less like numbers, like how many people you're seeing in a day, opposed to what like kind of patients are you seeing? What are the patients coming away with? Yeah. And so that's kind of how Function First came to be. And that was, I think a little over 3 years ago.
All right. So you're looking for quality over quantity with your patients. That makes a lot of sense.
Yes.
I mean, it would kind of get frustrating too, I would think. I'm not a doctor. I've never had any sort of job like a doctor, but it would be frustrating if you're like, all right, we got this, we fixed it. They come back the next week, it's just the repeat over and over. Yes. It would kind of just get monotonous or a little disheartening even maybe.
Yes, and it's not even like really the fault of the patient. It literally, in the healthcare industry, like you mentioned with, you're giving this medication to treat a symptom. So then the person's never really wondering like, well, why is my blood sugar high? Yeah. They're just taking the metformin or they're taking the insulin that the doctor told them. When with type 2 diabetes, like the why behind it is like diet. It's movement. Are you burning enough calories? Are you burning the sugar? So yeah, that's what I mean when like, to just look beyond just that symptom, or to just say, hey, this is going to take 5 minutes to fix. Yeah.
Absolutely. So you said Function First opened in 2021, correct?
Yep.
All right. So I know, if I remember correctly from your website, you have a location in Humboldt and Fort Dodge. Yeah. Which one opened first?
Humboldt.
Really? Yes. So you're from Fort Dodge?
Yes. I had a non-compete. Oh. So yeah, I just couldn't open up practice in Fort Dodge right away. So, and my family and I, we live on an acreage north of Fort Dodge. So naturally, like the next near town was Humboldt. And it was crazy, had no real connections to the Humboldt community. I've obviously growing up in Fort Dodge, I had been to Humboldt for sports competitions, been to Humboldt for like choir and stuff in high school, but otherwise didn't know a whole lot about Humboldt.
Yeah, other than, Pasquale's Pizza and a handful of gas stations. There's not a whole lot there.
Yeah, that's what I always thought too. That's what I always thought too until you become a part of the community and you're like, oh my gosh, there's a lot here. It was kind of crazy how it all worked out. Like I had driven downtown one afternoon and I'm like, well, how do I even know what buildings are for rent? So naturally I went into a realty office and it happened to be Humboldt Realty. And I just asked Ross, I didn't know his name was Ross at the time. I said, well, do you have a list of like commercial rental spaces? And he's like, what are you opening? And I was like, chiropractic office. And he's like, oh, okay, come next door. And it was just one of those funny, I'm sure he was like, who is this random person that came in? And it's like been this like great friendship since. But yeah, so I started renting the space right next to his office.
Oh, cool.
Yeah. And
That's
then,
awesome.
yeah. And then he and his wife, of course, introduced me to different business owners downtown. We kind of have a grassroots monthly meeting that the small business owners along the like 3-block stretch downtown are a part of.
Oh, cool.
And so I got to know the other business owners on the block. And again, that didn't coming not from Humboldt. That's how I didn't know I was marketing at the time, but that's how I knew, that's how I got to know people. They got to know me. And if you're comfortable with a person, then you start to ask those questions like, how are you different? And then you have that one business owner who's like, well, I'm going to try this.
Yeah.
And they go, and as long as you stay true to like your course of how you want your business presented, if they like it, then they send more people.
Yeah, absolutely.
So, yeah.
I don't want anyone from Humboldt to at me or anything like that because I am from Humboldt. So I do live there, yes.
Oh, awesome.
Yes, we do have some nice trails. There's stuff going on. I guess I didn't know the businesses downtown did a little group meeting or something like that.
Yeah, it was shortly, I think, before, I don't know the full story, shortly before I became a part of the Humboldt community 3 years ago that the chamber dispersed. And when the chamber dispersed, there was like obviously hard feelings. People didn't know what they wanted to do. But again, like resourcefulness, business owners were like, well, what stops us from meeting once a month? You just say a time, say a place, and then everyone, if you can make the meetings, you go to the meetings. And then that's how we developed like events. There's a ladies' night out we do a summer event that this past summer we turned into providing hot dogs for the flood relief. So it's things like that. And as long as you like put them on the calendar and you say, hey, next year I'm going to do this and this, I think we're up to 5 or 6 events every year that we put together. So yeah.
Yeah, Humboldt loves hot dogs. They used to have an event there called Hot Dog Days in the summertime.
That's what everyone.
Really?
Yes.
Yeah.
Yes.
Yeah, you would show up and it's literally just like dozens and dozens of businesses down Main Street handing out hot dogs. I don't
What?
know. Yeah.
Yes.
Go.
And then they would, I guess different businesses would have like, they have relish, they have the ketchup mustard. And then you would just like, yes.
You technically have to go from business to business to get all the fix-ins or something like that. Or
what?
It's weird. I know it sounds like a weird thing, but it was packed downtown when they used to do that.
And that's what I read. And they tried, I remember homecoming parade, my first homecoming parade there, they thought about trying to revive the hot dogs and have hot dogs along the side. Yes. I mean, there's chili cook-offs. Like, why not just hot dogs?
Yeah.
Okay, but do they do like different flavors of hot dogs?
It depends, because I remember there was like a pizza place in town that had hot dog pizza, or something like that. This isn't the hot dog podcast. We should probably
But now
move
I'm
on.
curious.
Well, now
I want
I
to
am
have a whole
curious.
podcast about this.
Well, I'll tell you what. Maybe that'll be the next episode. Tune in next week for hot dog talk. So
No comment.
you opened up the Humboldt location first, and then Fort Dodge second. Correct. Okay. So what did your non-compete just expire? So you came back to Fort Dodge,
Yeah.
or was there like a need for it, or business was good enough in Humboldt, or it was working out? So you're like, second location might not hurt.
That's people. They kind of like always ask me how that came about. No, my non-compete was up months before I even like came about the spot in Fort Dodge. It was honestly one of those things where a friend of mine had always asked, do you plan on coming back into Fort Dodge? And I said, well, if anything ever opened by Iowa Central, like I'm interested in being in that part of town. Just with that college there, it's constantly growing with my sports certification and all the athletes on campus. I said, yeah, if anything opens over there. She, was going through the McDonald's drive-thru over on that side of town and looked to the right. And she said, I happened to see that the space was for lease.
Nice.
So she texted me that night, and it was kind of like, okay, haha, you're making me like hold on to the words I said to you. But no, I got a hold of a realtor again and was like, okay, well, let's go look at this space. And I guess the rest is history, except for, not history. We put, with the Humboldt office, the Fort Dodge office, my husband's a carpenter by trade.
Cool.
We renovated a house back in 2017, 2018 when we moved back to the area, that once you've like done work like that, you look at a space different. You look at it and say, I can do this work myself. I can put a little money into supplies and then see where it goes from there. So I think that was the unique and really blessed thing about where I sit at in life with some of those skills, is that it's not so daunting to think of taking on another space.
Yeah.
So that's how, Fort Dodge. And then Jen Rollins, she owns Past Tense Massage. She was the friend I was talking about. And so she now rents a room for massage therapy out of that office.
Oh, cool.
Yeah, we have New Hope Counseling. Lisa, she is the therapist that started with us a month ago. She rents a room from there too. And so it kind of now has become like this healthcare hub.
Yeah.
And it helps again. I'm just one person. And so bouncing between offices, I can't be at both offices at once. And so it helps keep overhead under control.
Yeah.
And it gives me, other people to chit chat with during the day. So it's been great.
I was kind of like that location over there by the McDonald's. That's it's over by the college. I almost don't even want to say the McDonald's, but it's over there by the McDonald's.
Everyone asks, where is it? I'm like, that McDonald's by Iowa Central off on 69. The office buildings behind it? I said, that's us. We're in there.
That's a neat little office building. I remember there being a lot of stuff there, and then it kind of, like you said, it just kind of emptied out over time, and now it's filling back up. I like it.
Yes.
So you have an office in Fort Dodge, an office in Humboldt. What makes your practice different than your competitors? Let me ask you that. I think we might have already touched on it a little bit at the very initial question, but let's go over it.
Because I too, I get asked like, well, what do you offer differently? Well, my adjustment, argumentatively, the more years you're a chiropractor, you become better at it. It's a hands-on technique. So the more you adjust people, the better you become at it. But again, really other great manual chiropractors in Fort Dodge. Dry needling, I got certified in shortly after I opened the Humboldt office. But now we have, I think, 2 other chiropractors in Fort Dodge doing dry needling. So that's not too different. Yep. I would say like my approach. It sounds funny when Mackenzie touched on with the alphabet soup behind my name, but with every certification, it's not about just putting letters behind my name. Like I genuinely want to solve the problem for the patient. And if I don't know how to solve the problem, guess what I'm doing within that year? I'm going to take more continuing ed courses. And what does continuing ed course sometimes come with? Extra letters behind your name.
More letters.
Yeah, but it's the approach. The 2 techniques that I really pull from for my assessments are, it's called McKinsey. Decompressive therapy,
Not
MDT.
me. I didn't come up with it.
Not the McKinsey. I know, you're like another Mackenzie, seriously. And DNS, it's dynamic neuromuscular stabilization, which is an exercise-based therapy and approach. But like when people come into my office, it's not like you're going to get this and then you're going to get this. It's like a new person comes in based on what they tell me. I'm going to have them maybe do a squat, have them maybe walk down my hallway. My patients will laugh and they hear it. I got to make you hurt. I have to see the pain and I have to see what causes the hurt to then like give you an exercise, a stretch, play around with it. Like have them load 10 reps of this, have them go back to walking down the hallway. Does it get better? And so it's really my assessment approach. I think that makes it a little bit different at Function First.
Nice. Yeah. You'd mentioned a couple of techniques you have. What exactly is dry needling?
Yeah. So dry needling is using basically acupuncture needles, sterilized needles that we put into, I guess what you could call trigger points. They're like parts of the muscle that are tight or hypertonic. And by sticking them into there's a couple of different philosophies on how it works. Physiologically, if you think about it, I'm sticking a needle into you, which is causing an injury. What does the human body do? It's going to respond by healing that injury. So if you stick it into a muscle that's maybe tight, apoxic, doesn't have good blood flow, you are going to bring blood flow. You're going to get a cellular turnover and you're going to get healthier tissue afterwards.
Yeah, she's done that to me.
Yeah. And then there's other like the theory of if I hit directly into a active trigger point, you're going to get like a little spasm. And after that spasm, you're going to get the muscle to relax out. So then you can get, again, if the muscle relaxes out, you're not going to feel so much tension in said area.
Yeah.
Yeah.
So we talked about a few of the services that you provide. Do the services differ depending on location, or do you offer all the services at both locations?
No. So up in our Humboldt office, I have what we call an axial traction table, and it is for a lot of radicular pain, pain that generates from like the nerves of the spine and maybe go down your arm or it goes down your leg. So we use that therapy in some cases. So that's only in Humboldt. And then we have cold plunge therapy in Fort Dodge. That's what. So our cold plunge tank, when I opened Fort Dodge, it was going to be the gear or the like vibe of the office was going to be very active care. Like that's kind of what my wheelhouse is, but I wanted it to be feel like active care and then recovery. And so we have a whole room. When people ask, well, how does it really work? And I'm like, well, you ever been to a tanning bed? I said, it's kind of like a room. Tanning facilities have tanning beds in there. I said, we have a cold plunge. And then, so essentially you get the room for like 15 to 20 minutes. There's a lock on the door. There's rules you have to read. But the whole goal, I tell people, is to get in the cold water and see how long you can last. For that first time, you're trying to get like at least 3 minutes under your belt. Our tank currently sits at, today it was at 50. I've had it down to 48. We have people that consistently, like on a monthly basis, weekly basis, cold plunge. And sometimes we just have people that want to get gutsy and try. And at the beginning of the year, actually, we had a really great opportunity. We had the St. Edmunds girls track team. Before their state go, they did their team time in our office. Nice. And it was awesome. So then the girls could cycle in and out of the cold plunge. Some of them just put their shins in. Some of them got all the way in. They ate tropical smoothie wraps, had fun. And so, it was just one of those things too, though, to reiterate to those young athletes, like, hey, recovery is important. Like you need to be eating right. You need to be doing like icing. If you get inflammation, you need to be like stretching and doing things like that.
Yeah. That cold plunge, when I think I saw it on your website, I was just like, we got to ask about this.
Right. You're like, what is going on here?
Yes, absolutely. So what steps do you take to make sure that to ensure a personalized experience for each patient that you have? Do you go through like a diagnostic process or like an intake process of some sort?
Since we're a doctor's office, so you're going to have that obnoxious like 10-page paperwork when you start a care at our office. But again, the jokes aside, that paperwork, some of the questions about like past medical history, what medications you're on, have you ever been anywhere else? What have you done? Really, how we make sure that like every patient is getting the care they need is that first day. So that paperwork I read through it. And then I sit in front just like this in a room. It's so funny. People come from other offices and they immediately want to get on my table. And I'm like, stop, what are you doing? I said, we're going to sit and talk. And because you have to hear people out. I mean, how often do you feel like you go to the medical office and you're like, go in with something, you don't get to say your piece about what's going on with you. So sitting down, listening to what they have to say about it. And then we always do reflexes. We do motor testing. Ruling out worst case scenarios is key. That's how you avoid any of the scary things that you hear come from chiropractic offices. If you're going to a chiropractic office that goes through a proper exam, then by the time you get to the end point of treatment, you have to think of it as always going to be, is this person going to get treatment or is this person not? And enough red flags are going to steer you to this person doesn't need to be adjusted or treatment today. This person maybe needs to touch base with their medical provider and then come back in. So or possibly do a small lifestyle change and see what happens from there. And it's baby steps sometimes with people too. I mean, chiropractic care, it's just like this wide range, right? So you get people and they're always like, well, the chiropractor didn't help me. I'm like, well, that chiropractic style didn't help you. It doesn't mean that another office may not be able to provide an answer for you, because we all do things slightly differently. Yeah. I mean, 100%. I've been to only a handful of chiropractors in my life, but like you said, they're all very different. Yes. You know, so some of them are a little bit more involved and some of them, for lack of better terminology, might be less involved. Yes.
I definitely have been to a couple different chiropractors, and yours was definitely, I don't want to say completely different, but completely different. Like, you took the time. Yes. It wasn't just like okay, get on the table. Okay, bye. Yeah. 5 minutes later. Like, yeah. That like always stresses me out too. Cause I'm like, well, I know we're done.
Yes. And that's, I always like, it felt strange to me when like put in a setting like that I used to practice in. Cause I always felt like, well, I know so much more. And I'm like, how am I supposed to tell this person all the things that they should be doing in 5 minutes?
Yeah,
and
exactly.
So,
Yeah, 100%. So how do you stay updated on all these latest advancements, treatment techniques, et cetera, in chiropractic sports medicine? I mean, we only went over a couple of the techniques. Maybe we'll swing back and talk about a couple other ones here.
Just constant continuing education. I still hold my Minnesota license, and then of course my Iowa license. And so each state requires a certain amount of hours. And then of course my CCSP, I have to do 12 specific hours to sports medicine care in a year. And so it holds you accountable. But also, aside from that, I end up taking I think one year I took 80 some credit hours. I think that was back in 2022. And it was, you should speak to my husband. I really, I'm a nerd at heart. I just, again, love learning information, because you never know what you learn in a class, that when someone comes in front of you in a treatment room as a new patient, that you're like, that's what that person has. This is what we need to do with this person. And so if you don't keep taking continuing education, then you might be in front of a person that they're saying something, and in the back of your head is like, I don't know what I'm going to do with this person. Yeah. And I don't want to be in that spot.
Yeah. Or maybe it could be a situation where you're like, I learned something, let's just say you do this for another 30, 40 years. And then you're just like, well, I learned something 30 years ago and this is what we did. But it's like, well, it's changed since then,
Yeah. And that's where I was just in Salt Lake City this past summer taking a course in athletic return to play protocols. Because that, especially with concussion and all the changes that's been going on with managing concussion, diagnosing concussion, that was a really good course to be taking, especially in the communities that I'm in, seeing so many of the high school athletes. So that I can confidently say when they come in, when I clear you, you're on the field. When I clear you, you're on the court. And I can say that with the utmost confidence because of the continuing education that I have behind me.
Yeah, absolutely. So what are some of these other techniques? We had talked about dry needling. We talked about MDT, which was...
McKinsey.
Yes. What was the other letters? I think I have it written down wrong on my notes here.
Oh, McKinsey, diagnosis and decompressive therapy.
Okay, so decompress, that's what I don't have in here. So we also have DNS, you had mentioned, I believe?
Yes.
Okay. What was DNS? I don't know if I remember.
Yeah, because I was like, I can rattle stuff off really fast. Dynamic neuromuscular stabilization. And it is basically a technique, an exercise assessment and treatment technique that we look at movement patterns based off of the first year of life. Okay. So your first year of life, I don't know. Do you have any children?
No.
Okay.
I thought you were going to say, did I have a first year of life? I'm pretty sure I did.
That's what. Were you?
I was alive.
Okay.
Yes.
You weren't just, you didn't come about.
You were alive that first year?
Yes, I was.
But no. So I always say, but if there's no parents in the room, it's tough. But we've all, when you watch your child grow in that first year, they are going to kind of go through the same movement patterns, meaning they're going to be able to, they'll be on their back. They can bring up their knees. They're going to be able to roll over. They're going to be going into a crawl position. And all of these follow specific month periods. Mm-hmm. But it's because that's our software as a human. Mm-hmm. That you don't have to think about it. That baby's not now I need to roll to my right and go into crawl position. They're just happening. Mm-hmm. Yes. So we tap into it by using those positions. So we put people in a crawl position. Then we say, have them lift a weight with the right arm. And then see the response in their kinetic chain with what happens. And then that usually tells us, hey, this is weak, this is not activating. And then we know where to go with corrective exercises that way.
Yeah, I remember reading about how children progress through time, in their first couple of years. I remember reading a lot about that in psychology classes that I took. And that was something I was like, this is actually pretty wild,
Yeah, with the midbrain and everything. And I always tell people too, with some of the coursework I've taken with the functional neurology side of stuff, it just starts, things click in your head. When you get stressed, where do you feel your tension?
In my shoulders.
Yeah. Neck, shoulders, that area, when you go up into a crawl position, the baby has to be able to lift their head up. And that is in our midbrain, which is one of the first areas of the brain to develop. And so it feeds into our frontal lobe. So if you get stressed, overactivates midbrain and you get those muscles tensing up. Wow. And you're just mind blown. This is how the body is connected.
All right. So there's a couple other ones on here. Was it kinesiotaping?
Yeah.
Is that the stuff I used to see the CrossFitters put on them and stuff like that?
Yes. All that colorful tape.
Yeah.
Yeah. So kinesiotaping, the brand I use is Rock Tape. There's different brands out there. But from a very basics, like sense of why I use it, inflammation and bruise control. So say you get a football player, they got hit Friday night really hard in the thigh, they have a giant contusion. You can tape different patterns for like reducing lymphatic like pressure in the area, or you can just tape to reduce that blood in the area. Because the longer the blood pools, it'll calcify the tissue, make the tissue tighter. And so we use it for that. You can also use it to correct motor patterns. So a lot of those CrossFit athletes, you'll see it like swirled around their arms. Those patterns are all to activate specific motor patterns. So for say like overhead throwing, you can tape a certain way. You can tape a hip for a squat activation. So yeah, you can use the tape in a lot of different ways.
Yeah, I if I recall correctly, it was something basically like when I had first seen it applied to somebody in the real world, they were kind of using it to supplement their motion, I guess. So it's not like a brace, but kind of sort of like a cousin to it a little bit.
Yeah, it's just it's very much again like activating proper muscles when they need to be activated.
There we go. That's why you're here. That's a better way of explaining this.
That's why she has all the ABCs.
All the ABCs.
What about, I'm going to mispronounce this one. Grayston technique?
No, you got it right the first time.
All right,
Look
cool.
at you.
Okay, I'm a pro now.
That's so the butter knife.
Right? Everyone's response. That's the butter knife. We're not really a butter knife.
Okay. It looks like a butter knife, though.
I know people like reference a butter knife or a spoon. No, it's a specific stainless steel instrument.
A butter knife
that has a beveled edge. It's rounded. It's not like serrated like a butter knife. And then we run it over tight areas that we want to treat, because first you're running it over to scan, in a sense. You're like feeling where through the stainless steel you can feel adhesions because they'll be bumpy, and then you just keep working those in different directions and until you break up some of that, in a sense, scar tissue, adhesed tissue.
It can be painful, trust me.
Yes.
So are there any other ones I didn't mention that are like, key techniques you do use? I mean, I did have a few listed here, but I'm sure you're always learning and progressing.
That kind of sums it up. This year too, I was in April, I was down in Davenport at Palmer College, where I graduated from. A lot of my coursework I take from physical therapists. I think there needs to be a better relationship between chiropractic and physical therapy. So if I go into a course with a bunch of physical therapists, I typically come out of that weekend, because I've talked with them, they've talked with me, and they're like, oh, this chiropractor does know a thing or two. And then they don't just think we're out there popping and cracking things for no reason. So it starts a better relationship. But also I learned more things. She was very into pain categorization, meaning people think like pain is not just pain. Pain is an experience. It's multifactorial. Some of it's based off of like if you had trauma in your past, it can set up different pain models and patterns. So I took that coursework just to get a better idea of, when I screen people and talk with them, hey, how much of this pain is coming from the injury and maybe how much is coming from something else going on.
Yeah, absolutely. So we were talking earlier about educating your patients about, they could just come in, get an adjustment, something like that, but that's not what you do. You want to try to educate them while you're providing services to them. How do you go about and educate, I would just say, like the general populace or people that might not know, like you said, if somebody was like a chiropractor's coming in, I'm like, cool, they'll do the whole twisty thing and get my back all crunched up and then I'll go home. That's not what you're doing. How do you explain to people this?
There's also kind of like a stigma with chiropractors.
Yes.
Yeah.
Like that's what you're going to get. And I want to break that, or I'm constantly breaking the language of people come and be like, my ribs out, my hips out. And I jokingly say, like, out to dinner? Like, is it out? Where'd it go? And the people, and I get where they come from, because I understand that chiropractic lingo is used all the time. But again, if I don't correct it and make it more about, hey, this movement pattern is off, let's correct the movement pattern, because that's something then they can feasibly say, I can help with that. Whereas if you're stuck in your hips out, I need to go to said chiropractor to get hip put back in, well, the power's taken away from you. You think you just need to go in and get it adjusted, when you maybe could do this stretch, this exercise, take tension off and improve things.
Yeah, absolutely.
So sorry, but I back to your question.
Yeah, no. You're explaining this all very well. I mean, so
how I get in the community and do this?
Yeah, do you have to like market this, or like how do you go about and tell people this stuff?
Lots of connections. When I first moved back to the Fort Dodge area, I met Kayla Benson.
Okay.
She worked at the rec. Got to know her really well. Our personalities jive. We're very much about, hey, help yourself, help you. But she got me a position at the rec. And so I would work, Wednesdays were my day off. So I would work there as a trainer. And I'd kind of be the side coach to the head trainer. And I'd walk around, and if I saw like a squat done improperly, I would help the person fix it. And then I did a few, like I did a foam rolling workshop there, a core workshop there while I worked there. Since being off on my own, and again, respecting the non-compete in the Fort Dodge area, when I came back in, I got hooked up with Jenny. She owns Rise Women's Fitness, Jenny Rowe. She's great. She's brought me into her facility to talk to the women there. I've done a series on like pelvic diaphragm activation with the core, done mobility stuff there at her place. So like put myself out there in a sense of like offering up an hour or two of my night. And just she gets her people there. We educate them in like a small setting like that. We're doing, let's see, November 18th, I'll be at SunMed with Rejuvenate Health and Wellness. We're going to do a women's night there.
Cool.
And chit chat to the people coming in, and then see and help people realize how, again, if pain is multifactorial, then sometimes you have to pull from different specialties and avenues to try to like help your specific condition.
Nice.
Yeah.
I love it. I love it. So what challenges have you faced as a small town business owner, and how have you overcome them? I would definitely say we probably just addressed one, the education.
Yes.
But networking was, the way that you kind of are helping get around that.
Yes.
Which, again, I think networking is undersold as far as, a marketing tactic.
Yes.
It always helps to know people. And if, again, if it's something that, maybe person A can't help with, person B, and you can send them that direction or go seek advice. But what are some of the things you've realized you had to overcome, and how did you overcome them?
Or still overcoming. Social media. Social media is big. That's where the younger population too is going for their information. Heck, that's where everyone's going. Like, how many times a day do you guys hear? Well, I saw on TikTok. I see it and hear it multiple times a day. And it's like, yes, sometimes that information is good, and sometimes that information doesn't apply necessarily to your condition. But I've had to learn to really put myself out there, like doing this right now, like put myself out there, get talking in front of people. And because the more you do it, the better at it you become. So I definitely need to work on my online social media presence. Cheryl tells me that a lot. But again, and then, of course, I think one of the biggest things when leaving one office and trying to start your own is we all understand in the World Wide Web that then my name is very connected to that office before. Well, I was lucky enough to meet Cheryl at the beginning stages, and she really kind of explained to me like the search engine optimization, the keyword stuff. She helped my business from day one so that my name, in a sense, was being disconnected from the clinic before and reconnected to what I was trying to grow. Because the faster someone puts you into Google and they actually get to the right location that you're at, the more important. Because too, you've searched something and then you have to scroll past the sponsored ones and then get to what you're actually trying to look for. And we're in a world where we want it quick. And so the faster we can like have my name connected to sports injury, or have my name connected to kinesiotaping, when people search these things, is the faster those people that want these services are going to be able to find me in my office. Yeah,
you had talked about something really big when you like leave a location or you start something new. Sometimes it's tough to disconnect from the old.
Yes.
And I recalled, I don't know exactly who it was, but I was researching something here in the office, and I was searching for somebody. So you type in their name and you type in maybe the industry they're in or maybe the town they're in, and it kept coming up with their old position.
Yeah.
And I was like, oh no, what are we going to do here? But it wasn't a client of ours, so it wasn't something we had to really worry about, but it was kind of something where you're like, what Cheryl's been saying this whole time is true. It's right here. There's the proof,
Yes.
You've marketed some of your services out to the community, or do you need to even market, or is it something where you came back to town and it's just like, people are knocking the door down that's left and right. They can't get adjusted enough. They need all of your advice and all of your time.
I wouldn't say like knocking my door down. When people heard that I was back in the Fort Dodge area, my Fort Dodge schedule got full very fast. And that's great. because that's cool that people remembered who I was from maybe being treated by me like 2 years prior or however long it was at that point. Word of mouth is giant. And I mean, everyone knows that because I'm going to trust the words coming out of my friend or my family's mouth about someone's care. And that's been really great too. Man, all the sports moms out there, you get a sports mom behind you, she will get everybody on that team and their family coming to see you. So I can't say enough about really the community, the patients I've seen, what they've done for my business. It's been amazing by word of mouth. I do, of course, use some local like newspaper ads in Humboldt. We now sponsor the Wildcat Athlete of the Week through 97.7 The Bold. It's kind of, the kids get a certificate. It has my logo on it. They get like for a week, they're the Athlete of the Week. It's really, it's neat. And it's in recognition to what the student athlete has done for themselves too. Because it's not always the person that scored the most or, blocked the most or whatever it might be stats wise. It might just be that they played an integral part in like the week before's game or match. So yeah.
Awesome. So how do you see your business evolving, in the coming years? You've been around for 3 years in this area.
Yes.
But you've already opened a second location.
Yes.
You've got slightly differing services in both locations.
Yes.
And so what do you see the next step is? Are you going to open a third location? You're going to have a completely, are we going to take over
mobile one?
Well, if I say yes, I'm like, oh my gosh, don't let my husband hear this podcast. He'll be like, you're doing what? That's what family members are always like, you're doing what? I'm like, I don't know. I feel like it'll work.
Yeah.
I honestly, what I hope, and things, it's a different area up here. I would love to take on 1 or 2 more chiropractors. But again, you would have to have people interested in moving into this area. So if that's not happening right away, then that's fine. I'm going to just keep working my mission and helping the people that I can help. And yeah, sometimes that means staying late, coming in an extra Saturday, doing things like that. But no, if all worked well, yeah, maybe a third location. It's crazy, but it drives my financial analyst crazy that I don't have this specific business plan, but I've kind of never have because you have to evolve with the present day. And I think if you stay too rigid and in 5 years, I want this to happen, then when it doesn't happen, you would get disappointed and that might like lead you astray, or maybe it wasn't right for you.
Yeah. Another thing with that is like, let's say you have a goal and it happens within, 3 years instead of 5. Now you're just coasting for 2 years, instead of being proactive and changing the goals, which, business goals should be a moving target at all times.
Yes.
Otherwise, you just end up being complacent, and that's something you are not complacent. You're not doing the chiropractic work from the 70s and 80s.
Yes.
Still you are progressing and learning new things, new techniques, incorporating them into what you do, and that's definitely a benefit to everyone that is going to seek out your services for sure.
Yeah.
What are some of the challenges that you were like, well, maybe if I'd known this before, it might have been better?
I don't know necessarily known before. I feel very blessed and fortunate. You have to meet people. You have to get out there and meet people, and force yourself out of that comfortable zone, because again, that's how you meet other professionals. For instance, that's how I met Andrea Oswald with Rejuvenate Health. And so kind of from day one, when she was starting up her business, we were like, oh my gosh, our philosophies on how we want to approach healthcare are very similar. And then if she does an event, then you're always I'm in her forefront. Hey, does Cindy want to be? And vice versa. And always throwing our names out there to help each other out. The same thing with like Rise Gym. Honestly, I think what's really undervalued anymore and kind of tough, especially coming off of like 2020 and isolation stuff, and some of the youth where they were graduating high school at that time or college at that time, and they weren't used to being forced to go like speak in front of people. It's really though powerful. Like if you can take yourself out of the comfort zone and meet more people and say, even if it's your mission statement or your 2-liner thing to more and more people, you become more comfortable with it, but it also like you believe in yourself a little bit more and a little bit more and a little bit more. And the more confident you come off as being able to tell people, hey, this needs to happen, the better off they're going to listen to you. And that was big for me too, is that over the years, it's funny. People were like, well, now Cindy just yelled at me. Well, yeah, kind of. But like, yes, I am going to scold if things are not done. But would have I done that in 2012 when I first graduated? Absolutely not.
Oh, wow. Yeah.
Yeah.
So you gain that confidence along the way.
Yeah. Yeah. And you got to let yourself, I guess, gain the confidence and put yourself around people who will inspire you and help you, opposed to saying, oh, well, what if you did this or you were this? Like, be true and know who you are and just. Yeah.
Yeah. It seems like a lot of the focal points we're coming away with here are very good ones. You know, you've got to constantly educate yourself and keep up to date on what's going on. You've got to network. I mean, that's a very big thing. And, you know, again, it just seems like such a good business model it just seems like a good fit for something I guess I would prefer. Maybe it's, you know, maybe that's just my preference speaking, but at the same time, I feel like I would like to go to somebody that's taking a deeper look into it than just kind of running you through the mill of the medical field, which is, again, I think that's what a lot of people have an issue with, just like a medical field in general. Is it just like, you just kind of feel like a number sometimes, you know, and I feel like that's what you're trying to, you know, avoid or get around. It's just that's not conducive to, I guess, people feeling their best, you know, inside and out.
Yes.
I love it. So is there we're down to the end of this. The last question, we've got a question I ask everybody on the podcast. And so let's see what we got here. Is there a time in your life when marketing impacted you and you possibly didn't even realize it?
It's going to sound really cheesy, but probably when I first met Cheryl. I didn't even know she was necessarily like saying what she was saying to market towards me. But you know how you get in conversation with people that's kind of like, well, yeah, I've dabbled or thought about doing this. And when I first met Cheryl, I didn't even necessarily know what she did. But she said, well, you know that like for a business, if you are opening up a new business, it's going to be very important that people can search your name. And I guess, yes, I do know that's important, but have I thought about that when first opening a business? No, because you're thinking brick and mortar, where do I need to be? For us chiropractors and everybody in the medical field, you're thinking about licensing, you're thinking about malpractice insurance, you're thinking about getting into network with insurance companies. The last thing you're kind of thinking of is, well, what if a person sits down and Googles Dr. Cindy chiropractor? Like, where is that going to go? Yeah. And it was just one of those like nonchalant comments she made, and I didn't even realize that. And then it wasn't till, I don't know, I think months later, that when I was like kind of into the thick of trying to open up my own place, I was like, I should probably call Cheryl, that lady that mentioned, hey, maybe it's important that, and it just happened to be, I think it was a family member that said, you know, when I search you, it doesn't pull up your new business. And I'm like, okay, that's probably not a good thing.
Yeah. So I that's definitely something. I mean, Mac, you do a lot more with that than I do, because you do a lot more websites and things like that. But that's something that recently I've taken to, as I've kind of done more with these podcasts, is like, is there a way that I can make this episode easier to find if somebody wants to search Dr. Cindy, you know, something like that. So those are the kind of the things I guess I've been like looking into more the last couple months, and I'm actually seeing some improvement on some of this. So this stuff all does work, you know.
Yes. It's definitely not an overnight like switch.
No,
which is not fun, but at the same time, it makes sense, you know.
Yes.
Yeah. I mean, the cool part about this is I've actually, and I have to go look and see exactly which ones, but I've gotten a few businesses where the podcast thumbnail that we made now shows up in the Google business profile for the business. So
oh, cool.
If they go in there, I mean, granted, some of them, there was like, there's 93 pictures that's in the Google profile. That's a lot, but you know, it was one of the ones that was in there. So it's like, if somebody wanted to go through and find it, they'd be like, oh, this person was on a podcast, and they can go learn more about them, you know?
Yeah.
You know, so that is very important. But I do like to just reiterate, you said, you know, word of mouth, networking, you know, those are two things that are, you know, always good. It's always going to be something that's going to benefit people. But, you know, when I'm sitting in my car on a break and I'm just like, oh, I might just see a chiropractor. I'm on my phone looking it up.
Yes.
So word of mouth is only going to go so far.
Yeah.
Yeah. All right. So is there anything in here we didn't mention that you kind of want to mention? Again, you get an office in Fort Dodge, office in Humboldt.
Yes.
You're there. What days are the offices open?
Oh my goodness. Let's see if I can like rattle this off.
Yeah, so this was not on the question
right?
sheet. So.
Humboldt, I am in the office from 9 till noon on Mondays. And then from 1 till about 5:30, I stay till 6 most Mondays, I'm in Fort Dodge. And then all Tuesday from 9 a.m. to 6, I am in Humboldt. Wednesdays, I'm in Fort Dodge from about 8 a.m. to 2. And then Thursdays, I'm back up in Humboldt all day from 7:30 to 5:30. And then Fridays, I'm back down in Dodge from like 7 a.m. to 5.
Do you ever get confused and end up going to the wrong location?
No, because I have amazing staff. So
Nice.
on my way out the door, they're either handing me a caffeinated beverage or the paperwork that needs to go to the next office or no, that's why.
I love that. That's awesome. If you need to know anything about this, I'm going to have links for this down in the description. So anybody that's looking for any links, if, we had talked about, sometimes I search things and I can't find them. Well, you don't have to search anything. Just scroll into the description, start clicking links, click like, click subscribe, whatever you need to do. Give her a call. Dr. Cindy's out there for you. Yeah, this definitely sounds like something I kind of might want to do. I've been debating getting an adjustment here lately, but I
need to call her again.
Yeah, it's been a while since I've been to one.
The shame sets in.
It does. The guilt.
Oh, I love it. Well, Dr. Cindy, thank you so much for taking some time out of your day to sit down and talk with us. I really appreciate it.
You're so welcome. Thanks, guys, for making this like a fun experience. This was great.
This podcast is produced by Spin Market and Digital. Located in Fort Dodge, Iowa, Spin Market's highly skilled team can help you increase your market by updating your website, improving SEO, designing advertisements, and producing podcasts that will grab the attention of your market. Contact Spin Market today for all your digital marketing needs at digitalagent@spinmarket.com or call us at 515-302-8026. And to learn more, visit our website at www.spinmarket.com. That's digitalagent@spinmarket.com or 515-302-8026. Or visit our website at www.spinmarket.com.